Thank you for allowing me to speak here today. My name is Heather Janine Logan. I'm a registered nurse and currently working in the MSN program at Regis College to become a women's health nurse practitioner. As a future provider of women's health, it's important that women, including those that are pregnant, have access to quality care for themselves and their baby, despite where they live. Therefore, I am speaking in support of HR315, Improving Access to Maternity Care Act. This allows practitioners to have their student loans paid for in exchange for going to an area where there is a great need of providers. This area is determined by the Health Resources and Services Administration. For a 2-year commitment, student loans would be paid for by the National Health Service Corps. I'm grateful that this bill was enacted after being signed by the President. However, I do feel that there is a need of improvement and awareness of the bill. In order to decrease disparity and improve access to all families, there must be providers located in areas that are underserved. These women, infants, and families should be able to obtain quality care to improve and maintain their well-being. With providers going to underserved areas, they need to give skilled, preventative, and supportive care during the pregnancy, labor, and birth. In addition, it would also include postpartum and neonatal period to promote a healthy motherhood, parenthood, and early years of childhood development. Early prenatal care is important in improving maternal health outcomes and healthier behaviors, especially since the underserved populations are less likely to have prenatal care in the first trimester. Health equity and healthcare equality are important components of the federal health policy. The National Health Service Corps plays an important part in this because this is how the areas of concern are identified. They can help by delivering services to underserved areas and by supplying the providers that deliver these services. This can decrease or eliminate such barriers as not being able to access quality healthcare services. Another barrier that has improved is the access to healthcare insurance or payment for these services. The start of the Affordable Care Act was associated with increased insurance payment for birth and the increased use of prenatal care. Getting established with an obstetrician is important in the first trimester so that the provider can discuss and recommend testing in the mid to late first trimester. In order for patients to receive quality care, it is not just about the provider. Proper equipment and facilities would also be needed. It requires up-to-date equipment to diagnose and be used for preventative medicine for women throughout their lifetime. I would recommend more healthcare workers to be recruited to work in these areas. There would be a need for medical assistants, nurse practitioners, certified midwives, and ultrasonographers. Other specialists could be used via telehealth for genetic counseling or maternal fetal medicine. This would also improve access to health care and decrease the inequity and disparities in the United States. It would also help the providers to pay for their student loans while they are performing a great deed for the underserved areas. Let's help decrease disparity and improve access to all families. Please continue to support this bill and perhaps improve it with the recommendations suggested today. An incentive like paying for student loans will attract providers in all specialty areas to consider relocating for at least 2 years. This cycle could continue and providers graduate and try to establish themselves in their practices. Thank you for listening to me today. If you would like to contact me with any comments or concerns or questions, you can contact me at my Regis email. Thank you.